First signs or symptoms of Parkinson's disease, and then things that usually bring to light or what we're people concerned about when individuals come in. A lot of times a tremor, so that's one movement that people may have that they're worried about or concerned about, so we're trying to differentiate essential tremor from Parkinson's disease a lot of times. Also incoordination issues, so if one side of the body is not working as well as it should, incoordinated type movements, slowness or stiffness, one side versus the other, those are some signs and symptoms that we look for. Sometimes it presents as just balance issues, so people will have problems with their walking, trouble getting in and out of a chair, trouble getting in and out of a car, feeling more off balance on uneven surfaces. So that can sometimes be the presenting signs that we look for. And our job is really to put all these things together and come up with a more clear diagnosis. So in Parkinson's disease, in addition to just movement symptoms that individuals develop or people have, a lot of times there's what's called non-motor symptoms that may develop as well as part of the disease state. And these things may involve sleep, they may involve the mood, they may involve GI issues, so constipation is a lot of times a concern we address, urological issues, sometimes blood pressure fluctuations up and down. So it is really a whole person or a whole individual condition. Initially, if people are coming in with symptoms concerning for Parkinson's disease, we again do a comprehensive neurological evaluation, neurological exam, looking for other signs or symptoms. Most diagnoses with Parkinson's is still on a clinical basis, so based off of symptoms that people have, how things are changing with time, history of other symptoms that might be there. So we take a collective history and the exam, put those two things together. That gets us most of the way toward a diagnosis. A lot of times we'll also send some lab testing, making sure that we're not missing something else that might be going on. Typically imaging is also involved with the diagnosis. So we'll usually get MRIs of the brain. Sometimes we'll take a look at the spinal cord if there's concern for degeneration or compression somewhere. And again, we take those pieces of information with the rest of what we've already obtained and again, try to help improve the certainty of our diagnoses. There's also some additional more specific tests out there. So there's no like yes/no test that exists for Parkinson's disease, but there are some other studies that we can do. So there is a skin biopsy study that we can perform as well that looks for an abnormal protein that associates with Parkinson's disease. So this test has been available for a few years now, so we do offer that test. And it helps with, again, the certainty of the diagnoses or potentially ruling it out if something else is suspected. There's also some more specific imaging tests of the brain that looks at how dopamine is used, which is a chemical that's deficient in Parkinson's disease. So we can do this test to see, does that information back up with what we're thinking is occurring? And again, take all this information together and come up with a likely diagnosis. A lot of times we'll also use medications as a trial to sometimes see if this improves symptoms. And if symptoms do improve with some of the medication trials we do, that adds additional information that we may be dealing with the Parkinson's diagnosis. So initial treatment after diagnosis of Parkinson's disease, a lot of the treatments for Parkinson's disease involve medications to address the movement symptoms that people may have. So tremors, stiffness, slowness, problems with balance. And a lot of it is trying to add back some of the neurotransmitters or chemicals in the brain that are not being manufactured as they probably should be. So medication approach is typically taken, and the recommendations now is treat early because that improves your quality of life. And it also allows you to be physically active. So the one thing that we do know about in Parkinson's disease that can help with stability as well as slowing down the progression is activity and exercise. So unfortunately, we don't have a treatment out there for treating the underlying cause of it as of yet. There are things in research phase, but the one thing we do know about that is helpful at slowing down the progression is activity and exercise. So my approach is trying to get the medication side of it as optimized as we can so someone can be active and bring that component in themselves. So Parkinson's disease being a neurodegenerative process, a lot of times we will have to move or make adjustments as time goes by. So it's an ever-evolving situation, and every individual is different with it. So everyone's treatment is customized to them for where they are at the point of Parkinson's disease. So typically we'll see patients every 3 to 6 months, just depending on if we're making adjustments or not, if they're in a stable phase or if they're in a more degenerative phase. And we may make a medication adjustments, we may get more therapy involved if we need to, we may do other evaluations, and sometimes new symptoms do show up and we take a step back and have to reevaluate and may order some additional testing in that regards. We're also keeping an eye on where people are as far as their symptoms coming up and down, moving with dosing medications, and we may need to bring in some more advanced treatment options. So always in the back of my mind, I have thought of, do we need to bring in some of the more advanced therapies, such as Deep Brain Stimulation, which is a neurosurgical procedure that helps with smoothing out movement symptoms. So some people are good candidates for that, and at what point we start to have those conversations and try to determine, again, to normalize people's movement as best we can.